This video will introduce you to the topic of intersex and the two articles dealing with the subject. Intersex is a biological condition that's been around since the beginning of human existence. It is a broad term that covers a variety of conditions in which a person is born with a reproductive or sexual anatomy that does not seem to fit our typical definition of female or male. So let's go back to biology a bit. Remember that a combination of X and Y chromosomes determine the biological gender of a person. When there are two X's, the person's born female. When there is an X and a Y, the person's born male. But what happens when a person doesn't have two X's or doesn't have one X and one Y? Sometimes the pairings are not either one of these combinations. These unusual combinations result in the birth of a child. Normally when a child is born, we proudly announce whether the child's a boy or a girl. But what if the medical team cannot tell? That child is considered intersex. The explanation I'm using comes from a website called Interact, a nonprofit. I'll be using some biological terms that are necessary to understanding the topic. For example, a person might be born appearing to be female on the outside, but having mostly male typical anatomy on the inside. Or a person may be born with genitals that seem to be in between the usual male and female types. For example, a girl may be born with a noticeably large clitoris or lacking a vaginal opening. Or a boy may be born with notably small penis or scrotum that's divided so it has form more like a labia. Or a person may be born with mosaic genetics, a combination so that some of her cells have XX chromosomes and some of them have XY. So what was done when a child was born and it was unclear what the child's gender was? Our society is used to dealing with two genders, male and female. Historically, parents with guidance from the medical professionals would choose the child's gender based on the physical traits most apparent at birth. If deemed necessary by doctors, parents would be encouraged to have their child undergo surgery to help him or her look like the gender assigned at birth. Some surgeries would happen as early as infancy. For this topic, you have to decide what you believe the best course of action is, or what rights the intersex child has, and what should parents be able or not able to do. Which article do you agree with most, and why? Who has the right idea? Is it other fellow intersex people who have experienced it firsthand? Is it psychologists? Is it medical doctors? Is it the parent? You will have to do some reading on the topic and decide how you feel. It's a tough situation for anyone, and there's certainly disagreement on what should be done. This article, entitled Should Parents Get to Decide a Child's Gender, talks about the biological and social issues in having parents choose a child's gender, but it's more focused on gender-altering surgery on children before they can advocate for themselves. The article starts out talking about people who are transgender, but that's to introduce the main topic and put intersex in context in terms of a person's right to choose. As you read, decide what type of evidence does it use to convince you. Is that evidence effective? If you were writing this article, what evidence would you have used? Be sure to circle things you think are important and make notes in the margin. There's a definite stance in the article and a call to action. It doesn't become clear until the end, so be sure to read it through its entirety. This article, entitled She's 7 and Was Born Intersex, Why Her Parents Elected to Let Her Grow Up Without Surgical Intervention, focuses on a little girl whose parents are allowing her to grow up naturally without gender-altering surgery. In this case, the little girl, Rosie, has the two X chromosomes that would make her biologically female, and she has male genitalia. Although Rosie's parents have given her a traditionally female name, they have not had any surgical intervention, opting instead to let their daughter choose when she's older. As you read, decide what type of evidence does it use to convince you. Is that evidence effective? If you were writing the article, what evidence would you have used? Be sure to circle things you think are important and make notes in the margin. Like the other article, there is a discussion about what is traditionally done, who advocates what, and how things are changing. It's just as important to read this entire article too. So for this topic, you have to decide whether you believe gender reassignment surgery should be the choice of the parents at the birth for an intersex child or determined by the child, once the child's old enough to make the choice. For this video, we've gone over what intersex is, as well as given a brief overview of the issues covered in each article.